continue to grow as COVID cases continue to spike right here in our region.
Well, joining us live again this morning is Dr. Rob Danoff of Jefferson Health. Dr. Rob, thanks for joining us as always.
Hi, good morning.
We're two years into this. We're still seeing COVID cases rise. Is this vaccine effective at preventing the spread of these new variants? And, what about people that may get this for the second or third time?
The vaccines were not designed to prevent infection. The vaccines were designed to prevent serious illness, hospitalization, and death. And that's what the vaccines are doing. There's going to continue to be variants. That's what viruses do. They change shape, they change size. So the vaccines have been remarkably effective in decreasing the severity of illness and decreasing death. So that's really important for everyone to remember. Now, there are more cases now. Cases are going up. In fact, the positivity rate in Pennsylvania and Philadelphia is between 12 and 14%, which is high. So we just need to be alert about this. And I want to stress, please try to get the vaccine if you haven't had it already. And also, if you have had the primary series, please consider getting the booster. So speak with your physician or healthcare professional.
All right, that's good advice there, Dr. Rob. So one of the concerns that a lot of people have is, we have this vaccine, but the strains of the virus, it continues to mutate. So how will we continue to keep up with the virus as it changes over these next several months?
We're going to hear in the news that there's this new strain, it looks different. That's what viruses do. They always do that. Look at the cold virus. There's over 200 different types of cold viruses. So over the next months or over the next years, it's not, surprising. I think COVID, in some form is going to be with us. So what we can do is four main things, right? Vaccinate, test. If you're not feeling well, please get a test. There's those free home tests. You want to socially distance. So if you're going to a crowded area, please try to keep at least 6 feet away. And certainly the mask. The masks work. My mask protects you from me. Your mask protects me from you. So those are the four tenets of what to do to keep safe.
Well, two of those things, Dr. Rob, you mentioned testing. So when should people test? I didn't realize the tests expire. I finally looked on, it has an expiration date on it. And also, if someone has recovered from COVID, how soon afterwards can they get a booster?
Yeah, so that's a great point, Jim. So first of all, the tests have a manufacturing and then an expiration date. And believe it or not, it's 4 to 6 months after the manufacturing date. However, the more experience we have with the test, what the FDA has been doing is extending the expiration date, sometimes by a year or 15 months. So go on the Food and Drug Administration website. If your test happens to have an expiration date that has passed, check and see if it has been extended. And for the most part, many of these tests' expiration date have been extended once by 12 or 15 months. So that's really, really important. And Jim, what was the second part of your question?
People that have recovered from COVID, how soon afterwards can they get a booster?
So, once you're feeling better, once you're not having a fever, once your symptoms are mostly all gone, you can get it. So it's really important to check with your healthcare professional. If you have had an infection and you've gotten through it well, you probably have natural immunity for at least 3, 5, 6 months or longer. So a lot of people wait a month, after you've recovered to get the vaccine. But it's best to always check.
All right. And Dr. Rob, we've seen a lot of schools reinstating their mask mandates. What do you think about that?
It's so important that the kids get in schools. We know that. It's healthier for them. They're used to socializing. It's also better for the families. Now, this is an individual decision regarding masks. So it's best up to the parents, up to the school district, and it's up to the spread in that particular community. In Philadelphia and the surrounding communities right now, there is a high spread rate. We can't get away from it. So if your children are able to, and say there's a parent who has health factors or risk factors, or there's a grandparent, if your kids are going to be exposed to them, it may be worthwhile for your children to wear masks, because then they won't be bringing it home to you or a loved one that may put them at higher risk. So again, it's an individual decision, but masks do work. But it is important that the kids are in school.
Extra level of protection. All right, Dr. Rob Danoff, we appreciate your time as always and your great insight and advice. Thanks, Dr. Rob.
Great to be here. Have a great day, everyone.
See you soon. Thank you. You too.